Overcomers, and welcome to this episode of Connect Ovar Coffee. I'm Rincy, the founder of Overcome, and today we are joined by a very special guest, Dr. Teresa Deshields. So Dr. Deshields, Director of Supportive Oncology at Rush University Medical School, and as past president of the American Psychosocial Oncology Society, she is a leader in this space and is passionate in her quest to advance the science and practice of psychosocial oncology. Her clinical practice is devoted to treating cancer patients and survivors and family members throughout the cancer journey. So whether it be diagnosis or treatment, survivorship, end of life, as well as grief. So as you can imagine, we have a lot to chat with Dr. Deshields today as we connect over coffee with her. Grab your coffee. I have mine, and let's talk for the next 45 minutes to an hour as we chat with Dr. Deshields. And if you have any questions as we go along, please type in the comment sections below, and we will get it addressed post the discussion. So with that, a huge welcome to you, Dr. Deshields, to this episode of Connect Over Coffee. Always an honor to have you with us.
Oh, thank you so much for inviting me. I'm happy to be here.
Thank you. So we have a lot of questions for you. So, but before we get started, I just wanted to, quickly understand what is the term, what does psycho-oncology mean? Can you tell us a little more about it?
I guess in its most foundational, psycho-oncology is about the psychosocial impact of cancer on an individual. But, that's actually also a little bit of a two-way street. So we're certainly concerned with how cancer impacts somebody's mind and spirit, for sure. And that's probably what most people think of when they think about that psycho-oncology. But also, there are some ways that your mind or spirit can affect your cancer outcomes or your cancer experience. And some of that might be, I guess an example might be the person who is so very anxious. Oops, sorry, didn't think about my phone ringing. Sorry about that.
No worries. Yeah.
So thinking about the individual who has perhaps so much anxiety about their cancer that they might avoid appointments, or they might have so much anxiety that they really have a difficult time getting themselves in for their surveillance scanning. So sometimes there are things going on in our minds that complicate the treatment experience in cancer and can complicate outcomes. So it's a two-way street, although we most commonly think about how people are affected by a cancer diagnosis.
Thank you. So based off of your answer, also my next question is, as we understand, treatment of ovarian cancer is important, but survivorship is another story altogether, right? So in terms of the top concerns for women going through this journey of overcoming and through your vast experience, tell us about some of the significant challenges you think our overcomers face in this whole journey of survivorship and overcoming.
Well, I think that one of the primary challenges is figuring out your identity as a cancer survivor. And I know last week in my patient care, I was having conversations about this with two different people. And one of it is just how central do you want cancer to be to your identity? And some people want that to be very central. They see it as a key part of who they are. For some people, it's just a very small portion of who they are. So that's a choice that people get to make, is that do they want to, how much do they want cancer to be a part of how they see themselves, how central or how peripheral that is to their identity? I think that's one of the key ones. And again, to appreciate that that's a choice you get to make. The world, I had somebody telling me one time, everybody keeps giving me pink ribbon gifts. I'm not a pink ribbon person. I do not want a pink ribbon. But so the world might try to nudge you a certain way about how you see yourself as a survivor, but you don't have to embrace that. You can make your own choices. I think also it's important to realize that in figuring out how you want to be a survivor, besides the choice I just mentioned about your identity, there are lots of choices that you get to make. And while having a cancer diagnosis isn't a choice that you got to make, you do get to have some choices about how you want to carve your path through survivorship. And some of that is about the identity question, but also just, do you want to make changes to your life? This may be the opportunity that some people take to make changes, to reshuffle their priorities, to refocus on their priorities. Maybe there's some things that they were devoting time and energy to that they don't value anymore. And why was I doing that to begin with? And this can be the impetus to make some changes. So along with that is, again, just kind of reconnecting with your values. What's important to me? What do I want to be a part of my survivorship path? And what am I ready to unload or get rid of?
Yeah, thank you. So, speaking to you, we have to bring up this fear of recurrence thing, right? So this is so central in the journey and the lives of almost, or actually, I can safely say all overcomers that face this journey. So, in terms of, I know there is no perfect answer to this, but from your experience, again, what would be your guidance to our overcomers in terms of managing this fear of the cancer returning, coming back the next scan? How should they navigate this?
I think from my perspective, one of the key elements is figuring out how to manage uncertainty, because no one can tell you for sure what's down the road for you, whether your cancer will come back or won't come back. And some people are planners. They really want to know. They want to have the road mapped out. That can be more of a challenge for them, just the basic uncertainty about cancer and what the path ahead will hold. So if you're somebody who's good with uncertainty, if you roll with that well, it'll be a little easier for you. If you're not, it's really important to figure out how to cope with that, how to deal with uncertainty being a fundamental part of your life. I also think that in general, there's the idea of present-centeredness. There's this expression that, I don't know if everybody's heard it, if it was just my mom who said this about not borrowing tomorrow's troubles today. But, this idea of if we let our minds go too far out and projecting what might happen, we can spend all our time there and maybe miss the opportunities that are right in front of us. Mm-hmm. So trying as much as possible to not get too far ahead of yourself about what's coming down the road, because again, that fundamental uncertainty. I know sometimes people feel like if the what ifs help me to prepare, but the what ifs can also rob you of what's right in front of you. So figuring out how to do that piece. There's also a few practical things people can think about. I mean, some people like their follow-ups bunched together so that they just, okay, I'm just going to pile them together and get through the follow-ups. Some people like them spread out. I feel better if I have some form of surveillance scattered over time. So little practical things like that, thinking about, do I want just the timing of things, how I want that to be. So there's that a little piece that you have some control over sometimes.
And so just to follow up on that answer, though, like you said, all of us come to it from a different angle. Certain people are more anxious than the others when it comes to this whole cancer journey, right? So is there any merit to, let's say that there's this particular cancer patient overcomer who has her appointment, let's say in the next week or something, scans and all that. So does it make sense for her to maybe perhaps schedule an appointment with someone like you before she goes in for her clinical appointment so that she is more mentally ready? Is there any evidence to that or guidance you could provide?
There are some places that will offer navigation, and that can be a way to help people prepare for those visits. I mean, there is, as you suggested, there is the benefit to using it as well as you possibly can. Sometimes people get into the medical setting and all those carefully prepared questions just fly out of their head, disappear. So, being prepared, especially if you're somebody who has a lot of questions, to get those written down, to think about what you want to ask. And sometimes a navigator, if that's available, can help you sort through that, or a counselor or a family member. Some forms of peer support, can offer that too, like just help you to focus on how do I use this time as well as I possibly can. Then, other than that, I think that there is a lot to be said for distraction. When something is looming out on the horizon and you can't bring it, speed it up, or slow it down, just trying to distract yourself as best you can so that you don't spend, the 5 days before the appointment all day dreading that appointment. Try to plan some activities that you enjoy, some very engaging activities, so that you are not just dwelling on that the whole time.
Yeah, that makes sense. Thank you. So symptom management, right? That's another big thing when not just ovarian cancer patients, any patient in general, when they're going through rigorous treatment and the whole process. What is your guidance when it comes to symptom management while going through treatment?
So I love that question because it's actually been a research focus of mine, is about symptom communication. And one of the things that I have documented and others have documented is that there's a gap in knowledge between the symptoms that an individual has and what their doctor thinks they have. However that gap happens, it shows up pretty reliably. And some of that could be that the doctor isn't asking the questions that prompt that, or that there's a whole lot going on in the meeting, and so it doesn't, you don't get around to that. But some of it is also that we as patients feel intimidated about bringing things up, thinking maybe this isn't relevant, maybe this isn't important, or I don't want to be a complainer. So there's a lot of reasons why we may not bring up things that we're concerned about. But the bottom line is that if your doctor doesn't know what symptoms you're dealing with, they can't help you with those. So it would be nice if your doctor had a proactive way of assessing your symptom experience, and you felt comfortable with that system and used it. If not, you still need to find some way to bring up about the symptoms that are bothering you so that they can be addressed, and expect to be heard and listened to. So that's a separate problem. If you are speaking up about symptoms and they're being minimized or discounted or disregarded or something like that, that's a problem. And I think figuring out how can that change? Is there a way to change that within the relationship with this provider, or is it bad enough that I'm going to need to consider a different provider? But expect to be listened to and heard and attended to. And don't, some of you may have had the experience at the time of diagnosis of you were concerned about something for a while and just trying to get somebody to listen to or pay attention to what you're saying, that maybe actually leads to your initial diagnosis. And I hear that sometimes especially with young adults, that they don't fit the demographic that maybe the oncologist has in mind. So people aren't thinking about cancer for them. And so they may have had their symptoms for a while, and I knew something was off, but everybody kept saying, oh, it's stress, it's constipation, it's whatever it is. So it's important to speak up, and what you're experiencing is important, and getting some help with those symptoms. Symptom burden is negatively associated with quality of life. The more symptom burden you have, the worse your quality of life. And I hope the goal for everyone is to have as good a quality of life as you possibly can. So some of that is just knocking down that symptom burden, trying to get symptoms attended to.
And thank you for mentioning all this. These are such important points that for many of us, or all of us actually, to speak up about what we are feeling, how we are feeling, and not minimize them. Because to your point, sometimes we feel rushed at doctor's appointments where we know that the doctor has come in, he or she has only 10 minutes. So I would just stay on my top 3 questions and then just let it be. But that means that the rest of the 7 that were equally important on my list were not even addressed because there was no time for that. So there has to be a way to kind of, for the patient, especially for someone who's going through this whole journey, as you said, symptom burden can negatively impact the quality of life. So it is critical that we speak up about how we are feeling and when we are feeling it. So, yeah.
There was another study that I did where we talked with patients about their decisions about what to communicate in the room. And then patients oftentimes were not even planning to speak up about symptoms that they had. They acknowledged that they had them, but there wasn't even a part of their plan. We talked with them before they went in the room, after. So they didn't intend to. And then there's the experience also of afterwards. Well, I meant to, but never got around to it. And so, and truth be told, that sexual symptoms are ones that people are most likely to not speak up about, and also psychological symptoms. So it's a way that, and maybe it's because we think the doctor's uncomfortable. Maybe the doctor does seem uncomfortable, and so we don't go down that road. But it's important to get those things addressed because they are so central to quality of life. And if you run out of time to even say, we didn't get to all my questions, what should I do with those? Is there somebody else that I can talk with, or can I email the questions to you, or just not giving up that, oh, well, I ran out of time and now I've got to wait a month till my next appointment or whatever, but just bringing that up, that I didn't get to everything that I wanted to ask, or talk about. What can I do about that?
That's fantastic. Thank you. And this brings me to this is a great segue to my next question, is about the patient physician dialogue, right? So we know and we understand this is very integral to this whole journey. But as you pointed out in your responses, that it is often very challenging to bridge that gap. So from all of your research and the work that you have done, what would be your top guidance, top 3 points in keeping the line of communication open with the physician? And you also mentioned that if it doesn't work for one physician, then second opinions are always something that it's gold standard for every should be for every patient. So just tell us what your thoughts are on opening this dialogue or even improving it.
Well, I think it's important to think about what type of relationship you want with your physician. And maybe it doesn't matter if it's really a consult that you're getting about a short-term problem. But if this is somebody you're going to be working with over time on an important issue like cancer, maybe your primary care physician, thinking about what type of relationship you want. Do you want, some people they want a doctor who will tell them what to do. And that's okay if that's what you want. And to find that type of doctor who will advise you and tell you what to do. Some people want it to be shared decision making. They want to be a partner with their physician in deciding what to do. And that's not the stance that all physicians take. So it's part of it's like thinking about what you want, what type of relationship suits you best, works best for you, and going about trying to find that, just to find somebody who is also good at the type of relationship that you want. And then, truth be told, there are some times that if you're a person who wants a good communicator, I want somebody who's going to talk with me, who's going to share information with me. There are times that you might sacrifice that for the best technician, the person who is the best at this particular thing, this particular surgery I need. There's sometimes we might sacrifice the relationship for a particular level of skill. But if you are really the relationship person, you want to try to have your key providers be physicians who also value the relationship and who will work in that collaborative way with you. So that's important to think about. First of all, what type of relationship works for me? What am I looking for? And trying to find the person who will provide that. And then there's very practical things like taking someone with you in the room, an extra set of ears to hear things, somebody who might prompt you about questions that you were concerned about, but maybe got lost in the shuffle of the day. So having somebody with you can be helpful. You can also write down your questions before you go in to try to keep you on track of where you are. Writing down answers is, I think, it's great, but sometimes that can be hard. It's hard to listen and write, but can the person coming with you write things down? Can you ask for written materials relative to what you've talked about? I belong to this clinical trial cooperative group. I'm on the ethics committee for it, and we were just had a meeting a week and a half ago, and one of the things we were talking about is patients recording a
Yes.
visit.
Yes.
Yes. So it's something that happens more frequently. I do recommend that if you want to record, that you ask beforehand, that you ask if you can record. We were talking about some physicians won't allow it. If that's important to you, maybe you want to not work with a physician who won't allow it. Some are absolutely open to it, but you don't want to do it without asking. I mean, that's just good, just common courtesy that if you're going to record anything that you ask all those involved. But they were in the discussion talking about finding out that a patient recorded, what the tape that they're, they need to do something about it, or and you find out without them asking, kind of hurts the relationship. So, but those little practical things about how to manage the flow of information, because oh my goodness, in cancer, there's so much flow of information.
And one curious question I had is I was also reading about this ongoing research on my chart activity and all the results being published to the patient automatically as it is released to the provider. So there seems to be a little bit of debate on that as to what is actually especially if the news is not good, or rather it needs to be distilled further by the physician, and requires a dialogue should the patient see it before even sometimes the provider gets to it. So I know that there's a lot of research ongoing in this space. So based on what you just said, the patient physician dialogue, I think this is a critical part of it too, that as a patient, do you want to see the results even before your doctor has had a chance to review and just call you or visit with you to kind of distill it for you, unless it's just the average tests, which it's not complicated. But other than that, that also kind of can become that space where that communication needs to strengthen. What are your thoughts on that?
Some of that is also personal preference. I feel like in cancer, it can be so complicated, right? The news can be so complicated, and having someone who's an expert interpret it for you, because there's information about biomarkers, blood values it's just a lot to sort through. And so having somebody put it into context. I had a patient maybe a month ago who had gotten some results. She didn't know what to make of it. And the doctor who'd ordered the test said, there's nothing we need to worry about yet. And she got stuck on the yet word. Like, so I do need to worry about this at some point, or, and just that got stuck in her mind. And she was so anxious about that. And then she has a primary care physician who they have a great working relationship. He has told her, don't open any results of stuff I've ordered until I send it to you, because I will put it into context for you. But he was able to talk with her about that, even though it wasn't his test, but just to help her get some peace of mind, because she couldn't get in touch with the person who had said, yet, we don't need to worry yet. But, I think it's the idea we have kind of defaulted to full access to information. And I do think that's a good thing, but it also can be confusing. Even just from a support group perspective, with all these targeted therapies and biomarkers, it can be so confusing in a support group about, well, why did you get that and I got this? It's much more complicated than it used to be back when there were less information, fewer treatment options. It's got everybody was on the same thing. But now it is so personalized, so individualized, that it gets very complicated. And I had a friend one time whose wife was diagnosed with cancer, and he was complaining that everybody is recommending a treatment that doesn't match her biomarkers.
Mm.
But everybody was trying to be helpful, but it was driving him nuts. It's like, that is not relevant, not helpful. And so I think the information piece is definitely something that figuring out how to manage it, and knowing for yourself if you're somebody who knowing information, looking at a test result is going to worry you before you have somebody put it into context. Like people new to cancer maybe don't realize that stable is a good thing. Sometimes stable is the result we're looking for, not necessarily shrinkage or whatever. And so stable can seem like bad news when it's actually good news. Just as an example of just somebody to put it in context can be very helpful.
Yeah, and then, I was just thinking that, with technology, these things are easy fixes where perhaps when the patient goes to the portal, there's an option for the patient that the results are out. Do you want to see it or view it later? Just one click of a button, you can decide whether you want to see it, then you take full responsibility of that anxiety, for the lack of a better word, because you are choosing to review. But if you choose that, okay, no, I want to wait until my provider gets to it and choose that option, then definitive choice, I think, that the patient can make, like small tweaks, but it can be made. I mean, technology should think about that in my head. So,
And that idea too of like, if somebody calls with results, so what if you're in the car? What if you're at work?
yes.
I remember once seeing an inpatient who her team had come in the night before to give her results. Well, her family had gone home. She was by herself, and she was by herself until the next day, and was just so distraught that she had been given information and didn't want to call her family, also them being a part and hearing about it, but felt very alone in dealing with that. So the ways that we deliver information, it's some people would say, I want it as soon as I can get it, no matter how I get it. But that's not true for everyone. And so it might be okay to say, even if somebody says, we have your test results, but you're not ready to hear it. I'm not in a place I can hear it. I'm not with the people I want to be with when I hear it. Say, what, I don't want that right now. Can we do this at another time or something? I mean, I think kind of interacting with that too, and putting your preferences as part of the equation.
So important. And communication to me is, especially in this complex process, is key for, I think for the team, the provider team, as well as the patient family and the patient as well. So I just came across this very recently where, there was this whole thing about the doctor being, you said, the doctor being very factual and, expert in his or her field, which is great. But, when it comes to communication, I think the biggest thing that we are all looking for as patients, even if that may not be entirely true, is a little bit of hope, right? I mean, you can be as factual as you want to be, but that doesn't mean you downplay hope. So it's so important for providers to remember that at every communication they have with their patient, that, yes, I have the facts and I can tell you that the word yet, right? So it is important to have that element of hope in that communication. I feel so important.
Also, I think, so as we're talking about this kind of individual differences, as we said, some people I want you to tell me everything you possibly can. And there's some people who find that anxiety provoking. Exactly. They really just want the big picture, and so I think it's important to educate your physician about this is, I really just want the highlights. Or I want to know everything you can tell me, and help guide them to how much information is useful for you. Because I think more and more the doctors have been trained to do full disclosure, but that doesn't work for everybody. I mean, some people find that, again, overwhelming or anxiety provoking. And so trying to help the doctor tailor to you what works best is, I think, important to be a partner in that.
And honestly, I mean, if we are in the age of personalized medicine, the personalized medicine does not stop at just the medicine. It stops at it is also including how you communicate, how you personalize your the way you're, you know, opening the dialogue with the patient from point A to point Z, right? So it also, to your point, it also need to personalize the patient and his or her, you know, temperament, how that person is and how you deliver the news based on that person and her temperament. So all of this is so important. Great conversation. So my next question is, you know, in terms of enhancing the quality of life while going to the treatment, and then on to survivorship, what would be some of your guidance? You know, it's a simple, easy tips that our overcomers can follow to just make the day a little better for them. So, I mean, in other words, if you were to design a perfect day for an overcomer, how?
Well, in light of what we were just saying, I would say in terms of having the best quality of life as possible. So speaking up about problems, speaking up about things that aren't working for you, to speak up about that so that hopefully there can be movement towards addressing those. I think that's important. I think also thinking about what's important for you and how does that show up in your life? You know, what's important. So sometimes I get it. Cancer comes into your life and you know the counter is wiped clean. You've got you kind of prioritize the medical stuff. I get that. And even during treatment, you know, what's important to you, and are there things that you can preserve, maybe in a different way than you did before, but what do you want to keep as a part of your life? And in survivorship, making some choices. Maybe there's some things that you want to let go of that didn't really serve you, that you somehow had just been carrying forever, but choosing about what are, if we think about Marie Kondo, what brings you joy or what's important, what are your values, and are they showing up in your life? And if they aren't, how can you get them back into your life? Maybe again in a different way, but that's important to make those things, have them represented. The other thing I would say is, and this for some people is the hard lesson for them to learn, but just allowing others to help you or to support you. It's a hard road to the cancer experience and survivorship, and just letting people help you where they can. It may be that you're somebody who's only going to allow that in very limited ways, but if there's some way to just to find out how to do that. Social support is important because we're really social creatures. And I get that there's a lot of individual differences about how much people want to embrace that. But if there's ways that maybe the life lesson that you need to learn is how to let others help you some, whether it's practical things, whether it's emotional things, whether it's a little bit, whether it's a lot, but just trying to figure out how to allow it. If there are people around you who love you, it will make them feel better too if there's ways that they can do something to support you. And if you help them to figure out what's the most meaningful way to do that.
Absolutely. So, you know, it's pretty well established that, you know, depression it's a great it's a big stressor for ovarian cancer patients, and you know there's a lot of research on that, and but there is, like you pointed out, there is not too much dialogue about this, about how depression can set in before or even during treatment, after treatment. And so what are some of your tips or guidance that you would share with us in terms of managing depression for someone who's going through treatment? And you know, we know that there are medicinal approaches to that, but what are some of the even like functional medicine approaches that you could share that could, you know, help with the symptoms and improve quality of life?
So in terms of depression, there's certainly a continuum of depression. And it may be that you just have some low mood every once in a while. Maybe you felt down initially after the diagnosis. And then there's some people for whom it persists. It's a kind of chronic issue. Maybe it wasn't before your diagnosis, but it has been since. But I think there's a whole continuum. But the bottom line is that depression as a disorder, well, here, I'm going to back up just a second. So that's one of the challenges, is that depression is a word in common usage. I might say, oh my gosh, that movie was so depressing. Yeah. And so it's something we use to describe a feeling, but it can also be a disorder. And it becomes a disorder when it is persistent and it's disruptive, when it starts to interfere with you living your life the way that you want to. So sometimes people with cancer, sometimes your loved ones, sometimes your medical providers will be like, well, of course you're depressed. You've got cancer. That's not true. The disorder of depression is not okay. It's not something to be dismissed like, okay, that's a normal thing. Um, it's something to pay attention to and to do something about if you have the disorder of depression, again, with it being persistent and being disruptive to your life. And so I don't let somebody kind of dismiss what you're feeling by saying, oh yeah, well, I get it. You've got cancer. So, not that's understandable. So I think in terms of depression, another thing about it that's bad is that it is associated with negative quality of life. So the worse your depression, the worse your quality of life. So that means it's pervasive all over your life. So again, worth addressing. Um, I think if it's more of the acute, short term, occasional thing, whatever you need to get through. If it's maybe you just acknowledge it's a bad day and don't stress too much about it. Maybe you talk with a friend or a family member. Maybe there's a treat that you can give yourself that helps you get through it. If it's the persistent thing, you maybe need to be more systematic about how to address depression. One, you mentioned about, medicine interventions, which are certainly available. There's so many of them. They tend to be not very, what I want to say, not have a bad side effect profile. And interestingly enough, in cancer, we use a lot of antidepressants for symptom management.
Mhm.
So there are antidepressants that help with nausea. There are antidepressants that help with hot flashes. There are antidepressants that help with sleep. So there's antidepressants that help with appetite. So sometimes we use antidepressants to help symptoms, or if you feel like I'm struggling with some symptoms and some mood issues, there might be one medication that can help with both. Another thing just to keep in mind is that exercise is one of the most effective things for depression. It's hard to know if that's purely endorphin based or if there's other biochemical aspects to that, but it's sometimes hard to tell people who might feel very worn out by their treatment that exercise can be good for them. But I think if you can find ways to move, and I'm not talking about running a marathon, but walking, doing something low impact or whatever, just to move your body, that can be helpful for depression. The other thing is too, I've talked before a little bit about this, but kind of what you value, but having some pleasurable activities to look forward to. Sometimes cancer can just take over your life, and maybe you're doing all you can to squeeze in the cancer stuff and try to work and try to take care of your family, but trying to make sure there's something to look forward to. And it doesn't have to be a big thing. It doesn't have to be, a big trip, but just something. Maybe I'm going to have lunch with a friend. Maybe I'm going to go to a park. Maybe I'm going to, get ice cream with my kids. Whatever, just something to look forward to can be helpful too.
Yeah, wonderful. Yes, absolutely. That is so important to have small goals towards happiness, right? As you go through this. Yeah. Um, so, I've read a little bit about this cognitive behavior therapy for cancer patients, and I have not read much about the acceptance and commitment therapy. Can you talk to us about these and how these interventions help in coping with cancer?
Okay. So cognitive behavioral therapy has been around for, I don't know, 30 years, more than 30 years. It's a very evidence-based approach to treatment. There is a lot of research on cognitive behavioral therapy. And nowadays in drug trials for depression or anxiety, it's usually the standard by which the drugs are compared. Like, do the drugs do better than cognitive behavioral therapy? So it's a very powerful intervention. For better or for worse, from my perspective, better, but some people may not feel this way. It's very much focused on the here and now. So it's like, how do we get things better now? So there's some other approaches that might be more based in the past, like how did you get here? Cognitive behavioral therapy doesn't spend a whole lot of time with that. It's more like, okay, what do we do differently going forward to get things better? So for a lot of people, that can feel very practical and helpful. Like, I don't need to rehash my childhood. I can just work on how to get things better. But in its basic nature, cognitive behavioral therapy is about two things. Cognitive is how you think about things. And are the ways that you're thinking making it easier for you, better for you, or harder for you? And then the other piece is the behavioral piece. So what do you do? And are the things that you're doing making life better for you or harder for you? So it tends to focus on those two domains, and there's tools that get applied in both those domains. For some people, it might be, that one's more of a problem than the other, but attending to both of those things. Now, acceptance commitment therapy is considered, some people call it third wave of cognitive behavioral therapy. So it's a newer intervention, also has some research base, not quite as much because it's newer. And in its most basic form, it's focused on acceptance. And acceptance is about coming to terms with what's happened to you and how to live with. So I find it works very well for cancer, because most people, cancer is a big event in their lives. It's like, okay, this thing happened, and how do I come to terms with this now being a part of my life? So that's what the acceptance piece would be about. And it's not about it's all good, I'm all good with this. It's not that simplistic. It's more like, how am I going to live with this? I don't have to necessarily even say it's good, but I do need to figure out how to live with it. The commitment part is kind of interwoven in some of what we've talked about before, but that's about commitment to living a life consistent with your values. So whatever that means to you, and just, are your values a part of your current life? And so some of that may be going back and doing some values work, identification work. Like, maybe I'm not sure what my values are. I haven't thought about them before. So there can be some of that, but then just trying to figure out, how do we keep these values as a part of your current life? So that's kind of I find the two approaches to be very, very aligned. I tend to use, in my own practice, I tend to use both and move back and forth between them. I sometimes will present two options to someone, saying, okay, this problem that you've identified right now, if we went through a cognitive behavioral perspective, we would address it this way. And if we were going to do it from a acceptance commitment therapy perspective, we would do it this way. Do you have any preference? One of the others suit you best? Because we'll go that way. And if that doesn't work, we'll go back and try the other way. But just, I think if you're looking for a therapist, especially related to health issues, that cognitive behavioral therapy or acceptance commitment therapy are a good fit for people who are wanting to get some psychological support around health issues.
Absolutely, and these are fascinating. And thank you for your clarification for both of these. It sound fascinating, and as you said, that this, to me, it sounds like it could be so beneficial for all our overcomers as they go through this journey, because especially the ACT that says, since it's new and it helps with the acceptance and the embracing what has happened and to live your best life through it. For anyone going through cancer, it just sounds almost magical. So thank you for mentioning that for both for us. So switching gears just a little bit, we have talked a lot about overcomers and patients who go through cancer. Just to give the due respect to all the caregiver community, just had a question on, we understand that, the caregiver stress and burnout, it's real, right? I mean, they're through this journey with their loved one, even though they're not physically feeling it is every second and every minute of the day, is spent trying to make their loved one's life better. So there is such a thing as stressors for caregivers. So from your experience, what are some of the things that you have, found out as the major stressors for our caregivers, and how can we help improve that?
I'm so glad you brought that up. I tend to think of caregivers as the invisible patient because their lives are absolutely disrupted by a cancer diagnosis in a loved one. But nobody tends to focus on them as much. The medical team does not. Maybe people in your support network do not. Everybody gets focused on the person with the diagnosis. And truth be told, everywhere I've worked, I've made sure that I could work with caregivers as well as a psychologist. And I've had so many caregivers tell me, I don't want the attention on me. I want it, I want it to be on my loved one. But they are struggling too. And I have to say, I think, all the uncertainty we talk about also affects the caregiver. How's this going to go? What's going to happen? How long is this going to be a part of our lives? But there is a particular element of burden from watching someone you love suffer and not being able to fix that. There a degree of helplessness, I think, that adds to the burden and the challenge of being a caregiver is watching this. And I've had so many caregivers tell me, I would take this on me if I could. I would love to take this away from my loved one. So there's something about that helplessness of having to stand beside and watch that can be distressing. I think in general, there's also the change in roles that happens. And so whether it's temporary or whether it's permanent, but, roles might have to be reshuffled. Maybe I, as the caregiver, need to take on more of the management of the household or care of the children, or maybe I need to step up and find a source of income for us if you were the primary breadwinner and are not able to work. Taking on just the organization required in dealing with a medical problem like cancer. So scheduling the appointments or taking care of the billing aspects or those kind of practical issues. So figuring out who's going to do what is my role going to be? What can I take on? And, there can sometimes be resentment about that. And, that's okay. You may still choose to do it, even if it makes you feel resentful that I'm having to carry everything here and nobody is worrying about me or taking care of me. That's real. That can be real also. Also, I've had some caregivers talk about the change in their fundamental relationship with the patient, whether it was maybe a romantic partner. And when you're caring for somebody in very fundamental bodily ways, it can adversely affect sexual feelings for each other. It can feel like you're more of a parental role or a nurse role than being a lover, a spouse. So that kind of disruption to relationships can be tough. For some people, maybe it's your adult, maybe your parent, but you feel like you're having to parent to take care of them. And so that can be a disruption and role that can be a challenge on both ends when it feels like the roles get reversed. So I'm now parenting my mother because she is overwhelmed and struggling with this diagnosis. And does she want to be parented? Can be an issue too. Maybe I want to do that for her, but she doesn't want that. It's been interesting for me to see in terms of decisions about when to bring in outside help. And I have absolutely heard it both ways where people will say, I don't want a stranger wiping my bottom, And then I've heard some people say with as much vehemence, I do not want a family member helping me with toileting. I do not want my son, my daughter helping me with toileting. I want a paid caregiver. So people make different choices about that, about who they want to help them with intimate caregiving tasks. And I know I'm going on and on about this. You can tell it's a soapbox issue of mine, but there are some caregivers who are freaked out by medical stuff. They may love their their family member with cancer dearly, but they cannot bear to be in a medical setting. They cannot see chemo. They cannot. They are so uncomfortable in medical settings. And what do you do with that? Can you be okay with that? Can we accommodate that in some way in our relationship? If I love you, but I will faint on the floor if I go with you to this. So it's as much as you can have a conversation about that, and not that I don't want to go with you. I can't bear X about where you would like for me to go, and can we find somebody else who can help us with this? I've also had caregivers who tell me that with all the medical tasks that now happen at home, since more and more cancer care happens at home, they worry about killing their loved one. They worry about making a mistake, a medical mistake that would lead to their loved one's death, and that is such a burden to bear. And so, getting the support you need, the training you need to do things. If you don't feel like it's something that you can manage, how do we get other help? Is there someone else already in our lives? Do we need to get some paid assistance? But I think just navigating how we go through this together is important.
Yeah, and in line with just the last thing you said, I also think that sometimes, decision making can be so stressful for the caregivers, especially if the patient has said that, I trust in you to make the right decisions, then it is just an overwhelming task for a caregiver to take on that role where he or she is making decisions for the loved one, if the decision is not the right one. So all of this is, it impacts, and it's a big stressor. So I'm just speaking from my own personal experience of having, my mother and others that I've cared for, that the decision making part, I think, is also very critical, that the caregivers feel a little burdened with, in terms of what if my decision is not right. So thank you. And then in terms of a patient caregiver relationship, I know, like, you talked about a lot of this already, but just in terms of, if you were to have like an open, honest, mindful, and respectful relationship, mutual relationship between the patient and the caregiver, what would be your guidance in kind of designing that?
Well, in having conversations about this with multiple dyads, multiple duos, there can be a big difference in comfort with conversation. How open, how honest we want to be, how much we want to talk about end of life can be dramatically different within a couple. And what do you do with that? I struggle with that as the therapist, because where's the compromise? How do you compromise between I don't ever want to talk about death and I need us to talk about death? That's a tough one. And I think it's just, some of it is, if you need to talk about something and the other person just cannot go there, are there other people you can talk about that with? Or can you at least come to a compromise that we don't have to talk about this regularly, but every once in a while, I'm going to need us to have some level of a conversation about it. And I know you don't like that, but I need a little bit of it, and just try to find some in between we always talk about it or we never talk about it, some compromise. But that's really tough. That's really tough when there's just different preferences about how open, how much to hash things out. Even in terms of diagnosis, do we share the diagnosis? Do we not share the diagnosis? What if there's a disagreement about that? That can be really tricky. Um, with my own husband, he had a heart attack at age 50 early, and I'm a talker. I wanted to talk about it. He did not want people to know. It was just not working very well, and so how you navigate that when there's just different preferences and you're a duo. You want the kids to know, you don't want the kids to know. How do we navigate that? And it may be that you need somebody else to help you talk through that and figure out how we're going to do this when our preferences are so different from each other.
Absolutely. Thank you. And that in itself, just kind of recognizing that we are at different places can help us come to the middle point too. I think sometimes we have lived with another person for so long that we, kind of don't even consider these things, that we may be looking at things from a very different perspective. So important to even come to that level of communication between a patient and a caregiver, that, okay, we are different, and how do we actually bridge the gap? So thank you. You know, you have so much to share. I mean, I could go on for another 5 hours with you, but just just in closing, a couple of questions. I know that you're involved in, a lot of research and good work that you're doing. So what is the thing that you're most excited about when it comes to psycho-oncology, and what does the future look like when it comes to including this and integrating this as a part of the mainstream clinical treatment option for clients?
Well, I'm excited that we are starting to talk more from the psycho-oncology side about resilience. I think that we've been focused primarily on things like depression and anxiety, and those are legitimate concerns. But we've been talking about that for a while. And I think the focus on resilience. So how do we help people to be resilient in the face of a cancer diagnosis so that they can bounce back, they can not be devastated by it. So I think this idea, and part of it is studying people who are resilient in the face of big challenges, whether it's a cancer diagnosis or there's the resilience literature actually started way back when on children who came from abusive backgrounds and how some did okay and some didn't, and trying to understand what helped these children who were able to come out of that and live good lives, decent lives. So, trying to learn about what promotes resilience and how can we try to help people get there as much as possible, because life is going to hand us difficult things, bad things. That's just the way our lives are. And so trying to make ourselves as hardy in the face of that as possible. So I love the movement towards resilience. The other thing that I think we're getting a little better about, but where we definitely need to go, is the support for caregivers. Again, I mentioned just in passing about how much medical care happens at home now. There's so much that happens at home. Things just over the course of my career in oncology, things that always happened in the hospital that now are happening in the home. There's more burden on families and family caregivers. And so how are we going to support those folks and help them through this experience? So those are two things that I'm excited about and interested in seeing where we go with those.
Thank you. That's especially the second point that you made. I feel like after COVID, a lot of things have changed where patients, which is a good thing, that the patient community has become even more independent and even empowered. After COVID, the medical system has done that. But to your point, there are also downsides to it somewhat, which unless we kind of focus on them, they're like the caregivers that you just mentioned, it's important that we recognize that the burden has increased and what are some of the things that we can do going forward for this particular community that is so essential and integral to the overall health, mental and physical health of the overcomers. So thank you. So Dr. Deshields, we have I think we're at the top of the hour, but we have shared I think so much of commonality between you and me in just kind of understanding this. And I appreciated the way you clarified everything with us and to us. So in closing, what message of overcoming would you like to share with our audience that are listening today?
Well, I hope I have echoed the theme of finding your path, that there are choices that you get to make. A lot of times, again, we feel like in cancer that things are just handed to us, or the choices are limited or are bad. But so finding your own path through this, there's not one way to do this, one way to get through this. And so finding what suits you, what works for you, speaking up for yourself, advocating for yourself, that's very important. And yeah, so speaking up when there's problems and expecting to be heard.
Wonderful. This has been a fascinating conversation. I can tell you that we have learned so much from you today. Thank you for your time. We greatly appreciate you and your participation. I know that our overcomers will greatly benefit from this conversation. So thank you very much again for being a part of this episode of Connect Over Coffee. And overcomers, thank you for joining us today. And like I mentioned, if you have any questions for Dr. Deshields as you watch this amazing conversation, please let us know. We'll be sure to address, and you stay connected and stay tuned for the next episode of Connect Over Coffee coming soon. Until then, you keep overcoming. Thank you and bye.